Danesco for the English session. Over to you.
Thank you, sir. Thank
For
you.
the English session.
Thank you, sir. Thank you, Hindi team. Thank you, Sahani sir.
Yeah.
Today is our 1906th day of continuous webinar. Thank you all the participants for joining with us. Before beginning the session, we'll have a silent prayer. Good evening and welcome everyone. Today is our 1906th day of continuous webinar. Today's our speaker is Dr.T.AJAYAN.MD. He is HOD in the Department of Practice of Medicine in Sharada Krishna Homeopathic Medical College, Kulashekaram, Tamil Nadu. He is national level faculty of IHK and winner of Dr. N.K. Jayaram Award. And he has more than 25 years of experience. And I'm inviting Dr. T. Ajayan to our forum. Sir, you're welcome, please.
Thank you, ma'am. It's an audible. Now it's an audible, ma'am. Okay. Just trying to share my PowerPoint.
Yes, you can share now. You're the co-host, you can share. Yeah, started.
Just a minute. Okay, ma'am.
Yes,
Hello, is it audible?
yes, audible and visible. Clear.
Oh, okay. Thank you. Once again, I joined here for presenting a topic. I'm very grateful to our organization. Again and again, give me opportunities for presenting a different topic in front of this platform. Then today, I would like to highlighting on important topic, then evidence-based homeopathic management in neurological rehabilitation, a clinical insight and integrative approach. You know, the management of the neurological disorder is a very difficulties we are facing. Therefore, always we are dependent on integrated method. Then before I am then here in the introduction, I'll say around 25 to 30 years experience. These 25 years, my early practice, the majority of cases is not related to a cardiology or a central nervous system disorders. During that period, the majority of our clinical cases are either an infectious disease or cases from gastrointestinal or hepatocellular, hepatobiliary system, or few, then again, musculoskeletal disorders, etc. But even the 100 patients are reached in our clinical practice, the majority of cases, around more than 60% or more than 60 to 70% of cases, either a higher level physical level disease. You know, then according to our great living stars, the George Vidolkar's concept wise, we are discussing the system wise, the diseases are discussing the system wise. There is the central nervous system is the highest grade, the highest point. Therefore, the highest level of the physical disease scientist management is very difficult in our day-to-day practice. Just I would like to highlighting these neurological cases, how will you manage with homeopathic medicine? The neurological rehabilitation has been traditionally focused on multidisciplinary intervention, including physiotherapy, occupational therapy, and modern treatment.
Are you moving the slides?
No, madam. No, madam. No. Shall I continue? Continue, ma'am?
Sure, sir.
Yes. Please wait. To restore the function, independence, and the quality of life in patients with neurological disorders. You know, the recent years, there is a growing interest in evidence-based integrative approach, recognizing homeopathy as a complementary tool in neuro rehabilitation. The multiple clinical studies and the case report suggest that homeopathy can play a supportive role in the management of various neurological conditions such as stroke, traumatic brain injury, cerebral palsy, autism, and certain neurodegenerative disorders. In this presentation, I would like to highlight the four case we are presenting in front of you. In current evidence, the supporting the homeopathy management in neurological rehabilitation. And here I will highlighting these clinical insight that drawn from the case studies and the controlled trials. The integrative practice, then combining the homeopathy with the mainstream, the neurorehabilitation method can enhance the patient outcome, emphasizing a holistic and patient-centered model of care. Then here, why we are decided this topic? You know, in South India faces the growing neurological disease, the burden with the prevalence rate over 2,500 per and neurodegenerative disorders impacting the quality of the life. That is, this statistics shows the number of the article, the indexed articles in Google Scholar and shows epilepsy, that is an 18%. The migraine is only 1%, but the Parkinson disease is a neurodegenerative disease, that is 68.9%. Then another group of disease, the neurodegenerative disease is Alzheimer's disease, that is more than 40%. Then autism around 21, cerebral palsy 10.1 respectively. The conventional treatment mainly provide the symptom relief, but often fail to then halt the progression or the fully address the functional and psychological need. The patient face ongoing challenges like persistent disability, limited treatment response, and restricted access to advanced care in resource-poor setting. Then here, the emerging evidence support homeopathy as a valuable adjunct to neurorehabilitation by enhancing motor, sensory, and psychological thereby improving independence. Such integrative solution to address the urgent gap in the current neurological care. In India, the hosting percentage of the global significant and growing the burden of neurological disease. Therefore, the great need is particular area. That is more than 80% of out of total global population. The disability asset the life years that is related to the neural then continue to reflecting increased mortality and disability nationally. The major activities include in this
Some network problems, unfortunately. lost
What
the
happens, sir?
network problem. Dr. Jayan. You can wait, no other options.
Yeah.
But I think this should not be considered an adjunct. I think this is the mainstream treatment homeopathy. The others are the auxiliary measures, I think. Because we have a lot of medicines for these neurological cases, as well as our medicines will act in that area. We can surpass the blood-brain barrier. Then why should we consider this as an adjunct therapy or this is the leading or major therapy? Should be. It should be. They will join soon.
Anyone call him? Dr.
Yes,
Dayan?
Yes, I shall.
Doctor? Dr. Ajayan?
Please wait.
He joined. I made him as a co-host.
Yes. Maybe due to rain or some problem.
Yeah.
His audio is not connected. That's the problem. I think again lost the connection.
Left, huh?
Yes, joined the lost.
Okay. I think there is no power supply in many places. Here also there is no power supply.
You are still in Dubai, or?
No, now I am in Kerala.
Okay. I think there is heavy rain in certain areas.
Yeah.
That may be the reason.
Here there is no rain, but no power supply.
The neurological problem in the electricity line. Connectivity losing. Recently, there was a seminar in Trivandrum conducted by the Rajiv Center of Biotechnology, and a lot of neurologists, specialists from different parts of the world participated. And our Dr. Bindu Biar participated in that session, and she got enough chance to explain regarding their work in Vidyaraya Homeopathy Medical College, Neurological Center, and got applause. So this type of
they are doing great work, right?
Yes, definitely. Because we don't have such education facilities, still these genius persons really blooming well.
Yeah, actually they are doing with their own risk, their own
Definitely.
Yeah.
Yes.
But after more cases, they'll get the confidence and they'll continue. They'll have.
Yes. Recently, she had done a wonderful case because there's a brain shunt in a child. It was broken, and the child developed this ascites because the shunt was broken. And fortunately, she gave some medicines and the patient rescued. There is no more convulsions. So that is the possibility of homeopathy. That is why this is the mainstream medicine. Because nobody can do that without make some invasive procedure. Nobody can do that. But our medicine did work wonderful, especially in the case of children. So what is needed is we need more specialist courses.
Yeah, exactly. Because those who studied or those who experimented, they have to give confidence to others also.
He's trying to join again.
Okay.
Recently, the National Homeopathy Council has started for the DM courses. 7 or 8 this sections. But unfortunately, what happened is that we lost 34 years. 1990, when the post-graduation started in India, and 2025, they are trying to implement the DM courses after a gap of 34 years. That means we lost 34 years.
Yeah, exactly.
Dr. Ajayan joined. Please make him move. Yes. Please make Bhagyan co-host.
Trying to.
Yeah, okay.
Madam.
Okay,
Yes,
sir,
sir.
you can start now, sir.
Okay. Is it now visible, ma'am?
Yes.
Audible?
Yes.
Okay, I'm very sorry because in the last class also same thing happened. Okay, then yes, it will complete it. The neuro rehabilitation is defined as the subspecialty within rehabilitation that aims to reduce the dysfunction and enhance the health and well-being of individual with the disease, disorders, or the traumatic injury affecting the nervous system. Then here. Then the neuro rehabilitation, just you remember, you are included. Then diet and nutrition, then physical therapy, the speech, then occupational therapy, then again need family support, and you need other therapies include respiratory and cardiovascular therapy, etc. Then the principles of neuro rehabilitation in homeopathy, that's an include individualized approach, the early intervention matters, then holistic care focus, then the continuous assessment, then another very important one is the neuroplasticity. The neuroplasticity, that is a very important area. That is the area we are homeopathic medicine more useful in this particular area. Then neuroplasticity is a brain is a remarkable ability to change, then adapt and recognize itself throughout the life in response to new experience. That is the neuroplasticity. The neuroplasticity refers to both structural and the functional changes in the nervous system that occurs when the neuron modify their activity from new connections or strengthen the existing ones. This means the brain can revive itself. The homeopathic medicine is working in this particular area and creating an alternative neural pathway to compensate for lost function or maximize the adoption in the face of challenges such as trauma, learning new skills, and recovering from injury. That is, we are focusing is neuroplasticity. Then what conditions can benefit from the neurological rehabilitation? Then first one is the vascular disorders such as stroke, bleeding in trauma, or a transient ischemic attack. Then second one is infections such as meningitis, encephalitis, polio, and brain abscess. And trauma such as brain and spinal cord injury. And structural or neuromuscular disorders such as Bell's palsy, cervical spondylosis, the carpal tunnel syndrome, brain or spinal cord tumors, the peripheral neuropathy such as Guillain-Barré syndrome is a complication of our certain infectious disease, muscular dystrophy, and myasthenia gravis, among others. Then episodic disorders such as headache, seizure, and dizziness. The degenerative disorders include that is amyotrophic lateral sclerosis, Alzheimer's disease, the Huntington chorea, multiple sclerosis, etc. Then the age-wise distribution of the neurological disorders in neuro rehabilitation, a population-based analysis is like this. I'm not going to there is more details. This statistics it shows the stroke is the major one of the cusp. Stroke, cerebral palsy, the neurodegenerative disease like Alzheimer's disease, then Parkinson disease, multiple sclerosis, the motor neuron disease, etc. The need of the homeopathy in neurorehabilitation. The first one is the conventional rehabilitation, focusing mainly on improving the safety and the motor performance. No single drug or medicine has been proven is an effective enough to significantly enhance the biological recovery in neurological condition. The next one, then homeopathy in rehabilitation. The integrating with the homeopathy into neurorehabilitation could help overcome the limitation of the conventional treatment regarding the efficacy, then affordability, and the holistic patient care. So here, affordability is a very, very important one. There is a protocol we are following in our hospital for the neurorehabilitation. This protocol we are developing with the help of integrated way. We are developing this protocol. Then a long time is need for developing this particular protocol, because then only the few sentences there. But for the development of this protocol, then so many months are need. That means that different cases we are treated with homeopathy medicine. During the time of treatment, we are facing a problem. Then again we are solved that problem and find so many cases in this manner we are treated, and finally we are developing this protocol. This protocol, if the patient is after arriving in our hospital, after registration, then only we are taking acute case taking. Then why that is an acute case taking? The reason is majority of the neurological cases and subjective symptoms are absent. But majority of cases only we are collecting the objective level symptoms. Therefore, more data we are not able to collect, even the life space and then history of presenting complaints and etc. Very difficulty to trace out that time. Therefore, we are using the acute case taking. Then later we are these cases we are for analysis of the case we are using the chronic case record. Then after that acute case taking, the decision for admission is based on the complaints. If we are in our limitation is there in all the colleges, like in our college also so many limitation is there. If we are maintain that condition, that time only we are decided to admit that case. Then in admission in IPD or OPD, then immediately we are assess the initial assessment. Then after that only we are going to, then is a detailed case taking and diagnosis. Then after the initial assessment, then assessment using the various standard tools and scales we are using. Then for example, a hemiplegia patient, then suppose the same patient, the slanted speech is there, then maybe the patient is, the motor function is altered, then sensory function is altered. Therefore, different scales, the different protocols we are used there. Therefore, we are decide the protocol, what type of the protocol is essential for this particular time. We are decided, and that protocol basis we are start the treatment. The protocol, the considering is an help for the diagnosis and as well as is helpful to the management of the cases. This always the protocol based only we are treat the cases. Otherwise, the so many difficulties we are facing during the time of treatment, difficulties we are facing. Then different tools we are using, and all the time we are using the different tools for assessment and for the prognosis. Then after assessment, diagnosis and assessment, then next we are decided if you are needed the neurorehabilitation. The 3 levels of the neurorehabilitation we are advised that for case. The first one is diet and nutrition, then psychological therapies, including psychological counseling, the learning, if you are learning a related disability, there is a related assessment you are done. Then suppose you are managed as a part of the management, you are advised the music therapy, speech therapy, meditation, etc. Then in physiotherapy, that means the physical therapy, They are include physiotherapy, occupational therapy, then magnetism, then sometimes you are advised the water therapy, yoga, etc. If the neuro rehabilitation is there, this protocol along with the right individualized homeopathy medicine also you are used. The right individualized homeopathy medicine, after that the periodic assessment. Every time we are assess the case, that assessment basis the next management we are decided. Then 4 cases I present in front, then a case study. Then first case we are presenting is an acute neurovascular emergency. There is an ischemic stroke. Is managed with a homeopathy. There is a case report. Is the background of this study. The ischemic stroke remains as a major cause of adult disability worldwide, particularly in older individuals with vascular the comorbidities such as diabetes mellitus, which increase the vulnerability of cerebral vessels to occlusion. Why this case we are presenting here? The reason is the lesion, that means the infarct involving the anatomically we had work out the left capsuloganglionic region. That is, I would like to say, if your patient is arrived, suppose a stroke case is arrived, the 3 levels of diagnosis are needed that case. The first one is that through the clinical signs and symptoms, you are reach where is the location. That is an anatomical diagnosis. The next through this, then presenting with the presenting signs and symptoms. The second one is your pathological diagnosis. The first one is an anatomical diagnosis. Then second one is pathological diagnosis. Then only we are going for clinical diagnosis. You are directly with the help of clinical symptoms. Never you are directly for the clinical going to the clinical diagnosis. First anatomical diagnosis followed pathological diagnosis. Then only you are clinically diagnose the case. This case that is important because its an involvement is left capsuloganglionic region. Typically disrupt the corticospinal and corticobulbar pathway, producing acute neurological deficit, including contralateral limb weakness, the facial deviation, dysarthria, then altered sensorium. These are the clinical presentation. These clinical presentation wise we are reached the nephrotic area. Then as observed in this patient. Then early medical stabilization is essential in this case. However, a long-term recovery is depend heavily on timely and individualized rehabilitation aimed to restoring then patient altered motor, sensory, and cognitive function. Therefore, the right treatment, right time, that medicine we are prescribed, otherwise the patient is not improved. By stimulating the body's inherent, the self-healing mechanism and complementing to the physical therapy, the homeopathic management may accelerate is a neurological recovery, is and support the better adaptation during rehabilitation and contribute to improve the quality of life in post-stroke patient. In this case, the highlight the need for the multi-dimensional approach in managing the ischemic stroke, where the homeopathic neurorehabilitation can play the major valuable adjunctive role in enhancing the quality of the life. This case is a 66 years old man that came to our outpatient clinic in January 2025. The complaining of nausea is very acute. The nausea, numbness in his tongue, and general fatigue from coughing while eating. He was admitted to the casualty department for immediate evaluation. Then previously I say all the tools we are applied in this case and evaluate the case. This patient is experienced slurred speech, therefore mouth deviation to left and weakness in the right upper limb, and which attempting to stand and the confusion regarding time, place, person shortly after. He is immediately transferred to our small intensive care unit in our college. Here directed to the case to intensive care unit for monitoring, the close monitoring, and for the treatment. The patient was linked to pulse oximetry and other vital signs we are monitoring. The device support arrival to the intensive care unit and rule out the metabolic reason, metabolic any dysfunction, blood glucose level, electron level, etc. Then immediately we are check all these things. That means that particular area, all these facilities are very essential. Then fast illness, this case is there diabetes mellitus, the first 5 years, there is nothing relevant, family history is not collected that time from the patient. But immediately you are advised then Glasgow coma scale. Then you are just to check the BP is very low. That is a 90 to systolic and 50 is and diastolic. Then SpO2 is maintained around 96%. The pulse 80 maintained. The RBS is a little bit high. That is at 435. With the help of homeopathy medicine, we are not manage the situation. Immediately with the help of an integrated way, then with the help of a allopathy doctor, they maintain the situation. Then eye-opening response, the finding that time, the spontaneous blinking at baseline, that time we are given 4 point. The verbal response we are given 4 point. That is confuse, the conversation and answers. Therefore, we are given the 4 point. The motor response is obeys the command for the moment, but is disabled. Is then given 6 point. Then higher function center tests include then cranial nerve, then 7th facial cranial nerve, the mouth deviated to left, that is an hemifacial weakness, the motor facial asymmetry during then conversation and smile. Then 12th cranial nerve, again it's mentioned the tongue deviation towards the left side. Then again, Glasgow, the coma scale, GCS, the eye opening response, spontaneous open with the blinking at 4 point, we are already discussed. Then confused conversation again 4 point. Then command, they are obeys the command for the moment, therefore only given the 6 point. All these things, the 7th and the 12th cranial nerve. The 12th cranial nerve, the tongue is then observation that tongue deviated towards the left side. Then the diagnostic level, then first I previously say the first level of diagnosis is an anatomical diagnosis. That is an acute. The pathological diagnosis, that time is an ischemic stroke. The considering symptom, that time drowsy, the stupor, general sluggishness. Therefore, initially, even during after admission, immediately first time, without you consider other details of the patient, first we are prescribed opium 32 dose. Then that time the suggested remedy is the Plumbamet 200. At that time we are considered side affinity left. Then atherosclerotic, the pathological, we are considered atherosclerotic changes, loss of speech and partial paralysis. This is the first presentation the patient in our ICU. There's a look here. The monitor shows it's a very difficulty to all the motor functions are very difficulty. Deglutition difficult. The initially patient is not able to move. They're commanding the motor function. During the time of the commanding, the motor functions are almost normal, but the patient is immediately start to cough. That is an indicator for the coughing, indicated to the difficulties we are facing while deglutition. At that time, then another tool we are used for the assessment of diagnostic criteria. We use this tool. The level of consciousness, then all these 3 days, the 9 to 14, around 5 days. Then first level of consciousness only 2/3. Then consciousness is improved and 14. Even after 2 days, the patient is improved. The level of consciousness is an improved. The visual, facial palsy, motor arm, motor leg, limb ataxia, then all these we are considered. These tools we are considered. Then another tool we are used for this assessment, mini mental state. Then assessment we are used this scale. The maximum score is 5. The patient score that time 3. Then what is the year, season, date, that type of questions we are asking. Then next another scale we are used the diagnostic assessment. Then House-Batchman scale for the facial nerve. We are assessing that indicated that is a moderately severely dysfunction. It's not mild, it's a moderately severe dysfunction. That is obvious weakness, the disfiguring asymmetry, normal asymmetry, and tone of rest, incomplete eye closure. Therefore, this case under in 9-1, the moderate to severe dysfunction. That is 11-1. Then after 2 days, that is again we are assessing the facial nerve. That is a moderate only. The third nerve is a moderate dysfunction. Then the 9-1, the assessment of the muscle strength of the upper extremities. That is the right and left we are assessing in right only 0/5. Then shoulder elbow flexion is impossible. The possible but difficult. That is right side only 2/5, but left side is normal 5/5. The elbow extension also again 2/5. Wrist flexion, wrist extension, hand grip right, all are 2/5. But 11-1, then patient is an improved. Then respectively from 0 to the shoulder abduction is raised to 3/5. Then others are from 2 is raised to 4. Then this diagnosis tool, then for deglutition, we are associating the E10 scale. That is, then my swallowing problem has caused me to lose weight. That is, that time is a 0, no problem, 0. The likewise we are assessing the severe, then score is then 4. Then here the pleasure of eating is affected my swallowing. That time this patient during while eating the cough when I eat, then score is 4. The swallowing is a stressful, the score is 4. But 11 after 48 hours, then all these 2 main force, that is including the first one is the eating is an affected by the swallowing is the great response, that is reached to 1. But other force are cough and eat, then swallowing is stressful, all are reached to 2. This and after the treatment, the mini mental state, the patient is improved, all the areas are improved, and finally you are discharged the patient. The 13-1 only we are discharged the patient. At that time the patient is able to walk, the lift the leg, there is no any difficulties you are facing. Okay, you are able to move, all the motor function and sensory functions are more, the patient able to eat properly, etc. Okay, then another second case I discuss with you, I will integrated management of right hemiplegia, then following the cerebrovascular accident with naxomic therapy, and along with the attended therapy, physiotherapy. Then why we are presenting this case? When the frontal parietal region is involved, the patient commonly present with sudden onset of hemiplegia. That is a clinical important. Yes, suddenly suddenly developing a hemiplegia is reached. The majority of cases, then anatomically, an area of the frontal parietal is involved. Then patient slide severe head and imbalance. Then CA is a significant neurological middle age and the older. The symptoms typically appear abruptly and require urgent evaluation and prevent further neurological deterioration. That means need the different tools, and with the help of the tools, with the help of these tools, we assess the case and the specific protocol is applied in appropriate time. For the diagnostic purpose, CT imaging is very essential. It is helpful to confirming whether it is.
It's again net problem.
Yeah, doctor.
Anyway, we must appreciate the work they have done. A nice protocol developed and so much hard work. I think the word neuroplasticity is quite novel to me because it expresses the capacity of brain to adopt according to situations and to accept new developments. Neuroplasticity. The another point I mentioned is the diagnosis of the anatomic diagnosis, then the pathological diagnosis and clinical diagnosis. So only a clinician who is working in a medical college will have such informations or updations. It is not possible for the normal or ordinary practitioners to follow all these things. I think Dr. T.AJAYAN.MD.
Yes.
Yes. Please make Dr. Rajan co-host. Dr. Ajini, T.AJAYAN.MD.
Sir, even if I finish the first case.
Yes, finished. You started the second case.
Okay.
With Maxomic.
Sir, here heavy rain, that's a problem.
Dr. Manoj, you are the
Sir,
host
and
now.
here very heavy rain. That's a problem. Guys. Sir, second case, the background I'll discuss with you.
Yeah.
Sir, is it audible?
Yes, it's audible and visible. No problem. Please proceed.
Madam, is it audible?
Yes, sir, yes.
Okay. The second case is a frontoparietal region is involved. It's a case of CVA. It's a 56 years of a old woman experienced sudden right side weakness. The like hemiplegia, so many symptoms are almost similar. Slurred speech and severe headache at vertex accompanied by the sweating and slight loss of balance. There is a case reported in 2024 September. The symptom lasted for 2 hours and improved after rest. The following day, he had persistent headache in parietal region, prompting her to visit a hospital where she was treated for elevated blood pressure and with the medicine and referred into the another hospital, King's Hospital, for the further evaluation. The patient is diagnosed there. They are diagnosed with the hemorrhage. The area is the left front of the hematoma. CT and MRI show of the. She was in ICU September 5 to September 24. When the
There were heavy rain and storm. That may be the reason why the network is very weak.
Yes.
From the very beginning itself, the network was weak.
Yes. Dr. Ajani is practicing in a hilly area, so definitely there will be strong rain and wind. That's a problem.
Okay. Not in the city, but
No. Around 25 to 30 kilometers away from Trivandrum city.
oh,
That's the reason.
staying in city or
No. Near to his clinic.
oh yes. Join again. Join again.
Yeah, yeah.
Regular doctor also find it very difficult to join now. He's trying again and again, but not able to join.
It is visible now, Dr. Then. Physical
Oh,
examination.
sir, very sorry, sir.
No problem.
Yes, okay.
Please
Then
don't do
vital
your
sign.
mistake, please.
Oh, okay, sir. Vital sign 88. The blood pressure is a little bit high than 116 per 100. Normality in respiratory and cardiovascular system. And the cranial nerve function are intact except left cranial nerve. That is the spinal accessory, then shoulder, the shrunk absent in right side. Mental state and cranial nerve normal. There is an after assessment, then flaccid, then upper and low, the muscle flash. That is power is that is 0.5. The normal everybody knows, and 5/5. Shoulder, fingers, thumb, knee, big toe, all are 0. But superficial reflexes, single reflex, the side is 2+.
I think it is better to have a second session because beautifully presented.
Yeah.
Very much. Yes, a lot of information is there. So I think it's better to conclude now and can have another session. Dr. Sanesh, what is your opinion?
Yeah, that is better.
Yes, that is better. That's better. And today the network is very poor. We
Yes.
can.
Within 1 or 2 weeks, the weather will change. At that time, I think we can have another session.
I think doctor will join again. That time we will discuss.
Yes.
We have 9 more minutes. Dr. Neelam raised hand. Okay, you can ask. Doctor, please.
Good evening, sir. Can I ask something related to homeopathy, but maybe not related to the session? If time is there, that's why I thought. Can I ask?
Yes, Dr. Ajayan also joining. You can ask the question.
Sir. So actually, I wanted to know that, regarding cancer treatment with homeopathy, many homeopaths claim that yes, they are doing good in that, but we have never touched such cases. But someday we have to start, and then some case comes to us. So they ask, like, what is the scope? What can you offer in the treatment of cancer? So what should be our answer? Like, because we actually, as I don't feel confident ki pura what I'll offer will be able to offer them as a homeopath.
Yes, doctor,
Even
please
if
wait.
minimum I forget. Hi, yes, sir.
Yes, Dr. Ajayan has joined. Let's.
Sir,
Okay.
again and again, then connection is interrupted. I don't know what happened there.
Sir, what we can do is we can arrange another session for another day so that the cases can be.
Because the same thing happened the last presentation also. The last time again the same problem is raised.
Sir, it
I
is.
don't know what happened there.
It is not your mistake, sir. It is. It can happen that during the rainy season because there is heavy rain and there may be some little bit of storm. That may be the reason, sir. Don't worry about that.
Then
Now we can
once
have
again I just to try the second case, sir. Or
Yes,
No,
sir.
sir, no,
Sir,
because I think it is better to start from the beginning on next session. Now we will discuss only 7 minutes more.
okay. Then any doubt regarding the first case or anything you are asking me? They are just trying to clarify that one. Otherwise, the remaining 3 cases, 3 different cases. Then next class I will discuss with you.
Yeah,
Okay,
that
sir.
will be good.
Okay,
Right.
sir, what is your modus operandi in treating such neurological disorders? Whether you
So
just
listen, sir, the neurological cases, the main thing is you need protocols. If you are not any protocols, you are not treated in a single case. Then because the reason is uh, every time that we are facing the complication, every time the chance of developing complications. Therefore, then for example, while managing a stroke case, especially while managing this type of cases, we are facing the very big problem related to the biochemical variation. Then for example, then variation in the sodium and potassium. There is a major issue we are facing there. Then one time the patient, the sodium is a decrease in the blood. Then after a year, correct the sodium, immediately the patient, the potassium level is altered. That way we are facing the lot of difficulties we are managing this type, especially this type of the stroke cases. Then with the stroke cases, the problem will arise. Then one of the reason is the patient is not able to give the food in the right time. The right way we are not recommended the food. Then again, after the certain procedures only we are able to give the food. Then, for example, after inserting the Riles tube, then biochemical assessment basis only we are advised to the right parental food. These are the problems we are facing by the management of this type of neurological cases. And second one, as a part of the management, the strict then individualized symptom. The symptom collected from the collection from the patient is we are facing difficulties because there is no any subjective level symptoms. We are observational symptom only there. Either we are data we are collected from bystander or with the appearance or their poster or their other objective level findings basis only we are select the homeopathy medicines. Then again, we are consider the pathology. Then for example, then a stroke case either ischemia, that means ischemia or is related to the hematoma, the bleeding. The bleeding is there this time cases in my ICU, we are successfully managed with both ropes. Then cases this time I am not able to present it, but then acute presentation, the right-sided hemiplegia, related symptoms, they are prescribed the both ropes. The patient is improved within 12 hours. Now the patient is and start to the patient is able to sitting posture, maintain the right sitting posture. But coming days, then patient is able to walk. Any other questions, sir? Any clarification is needed related to your first question? Again, you ask me, sir. Dinesh, sir?
Meanwhile, there is a question to Dr. Neil about the treatment of the cancer case. We
Yeah.
can say
So-
definitely homeopathy, a lot of cancer centers in Kerala. The Bandur Cancer Center is there. Then the Dr. Sajimohan, who is doing a well and is having an OP in the Adras Homeopathy Medical College. The cancer OP is there. Dr. Bindu John is specially trained in cancer cases. She is doing a wonderful jobs. Definitely homeopathy can do a lot of things in cancer, I think.
Dr. Neelam, are you hearing?
Yes, she's
Hi.
there.
Thank you, sir. So actually, I would like centers are there. Like if some patient comes to us, and we want to start like. So first counts like relatives come. Like if we refer also to someone like to some center, so they need something like what we can offer in cancer. Like so, what should we offer them? Like can it be completely cured, or the side effects of the because other therapies are also simultaneously going on. So,
There are enough videos in IFPH YouTube. you please go through the videos. Definitely you will get a satisfactory answer, I hope. Okay. In-
Okay,
Thank
sir.
Thank you,
Thank
Dr. Nanda. Thank you, Dr. Ajayan, for your time and effort. You again and again you joined and tried to present the cases. Unfortunately, because of the internet connection, we couldn't continue the session. What I'm suggesting from the beginning onwards, we will have another session for the same class. Thank you so much. We are eagerly waiting for your next session we actually need to hear all the cases. Thank you so much, sir, for joining with us. Thank you all the participants for your time and your support here. And now I am.
Thank you, madam. Thank you.
Thank you so much, sir. And good night, everyone. I am inviting Dr. Danesh for moderating. Dr. Manoj or Danesh? I don't know who.
Dr. Danesh is there, yes, please.
Yeah. I'm inviting Dr. Danesh for moderating Malayalam session. Thank you all the participants in the English session. And Dr. Danesh, you are welcome, please. Good night.
Thank you, Dr. Rajini.